1. What is arthritis? Arthritis is a general term for conditions that affect the joints or tissues around the joint. There are more than 100 types of arthritis. Most types of arthritis cause pain and stiffness in and around the affected joint or joints. Some types of arthritis, such as rheumatoid arthritis, also affect the immune system and some internal organs of the body. Learn more about common forms of arthritis in the Arthritis Types section. Experts use different definitions to gather information about arthritis in the population. Learn more on the Arthritis Case Definitions page. Top of page 2. What are the most common types of arthritis? The most common form of arthritis in the United States is osteoarthritis. Other common types of arthritis include rheumatoid arthritis, gout, and fibromyalgia. Fibromyalgia is included in arthritis for public health purposes. Top of page 3. What are the symptoms of arthritis? Different types of arthritis have different symptoms. Pain and stiffness in and around one or more joints are common symptoms for most types of arthritis. Depending on the type of arthritis, symptoms can develop suddenly or gradually over time. Symptoms may come and go, or persist over time. For information about the symptoms of specific types of arthritis, visit our Arthritis Types section. Top of page 4. What causes arthritis? Experts don't know the causes of many forms of arthritis. However, we do know that gout is caused by too much uric acid in the body. Sometimes specific infections can also cause arthritis. Scientists are studying the role of factors such as genetics, lifestyle, and environment in different types of arthritis to learn more possible causes and risk factors. For information about known arthritis risk factors, visit the Risk Factors page. 5. Am I at risk for arthritis? Certain factors make it more likely that you will develop arthritis. You can control some risk factors, and others you cannot. By changing the risk factors you can control, you can decrease your risk of getting arthritis or making arthritis worse. Learn more about arthritis risk factors. Top of page 6. Are people with arthritis more likely to develop complications from the flu? If you have a form of inflammatory arthritis, like rheumatoid arthritis or lupus, you may be more likely to develop complications from the flu than most people. Flu-related complications may include sinus infections, ear infections, bronchitis, pneumonia. People with inflammatory arthritis are more vulnerable to flu-related complications because they have weakened immune systems. These forms of arthritis and some of the medications used to treat them can both weaken the immune system. Learn about flu complications and warning signs to look for on the Flu Symptoms and Complications webpage of the CDC flu website. Top of page 7. How many adults in the United States have arthritis? An estimated 54.4 million U.S. adults have arthritis. Experts believe that number will grow as our nation's population gets older. Learn more about arthritis prevalence on the Arthritis-related statistics page. Top of page 8. Can children get arthritis? Yes, children can get arthritis. The most common type of arthritis found in children is juvenile idiopathic arthritis, JA, also known as childhood arthritis or juvenile rheumatoid arthritis. Signs and symptoms of childhood arthritis may include joint pain, swelling, fever, stiffness, rash, fatigue, tiredness, loss of appetite, inflammation of the eye, difficulty with daily living activities such as walking, dressing, and playing. Childhood arthritis causes permanent damage to the affected joint or joints. Early diagnosis and proper treatment are important to prevent or minimize permanent damage. There is no cure for childhood arthritis, but some children with childhood arthritis achieve permanent remission, which means the disease is no longer active. Learn more about childhood arthritis. Top of page 9. Can I prevent arthritis? You can reduce your risk of getting some types of arthritis by changing risk factors you can control. Risk factors you can control include overweight and obesity, joint injuries, and smoking. Learn more about arthritis risk factors. Top of page. Diagnosing arthritis. 1. What should I do if I think I have arthritis? Talk to your doctor if you have arthritis symptoms such as pain, stiffness, or swelling in or around one or more of your joints. Top of page 2. How is arthritis diagnosed? Doctors usually diagnose arthritis using the patient's medical history, physical examination, X-rays, and blood tests. It is possible to have more than one form of arthritis at the same time. There are many forms of arthritis, and diagnosing the specific type you have can help your doctor determine the best treatment. The earlier you understand your arthritis, the earlier you can start managing your disease, reducing pain, and making healthy lifestyle changes. Top of page treating and managing arthritis. 1. How is arthritis treated? The focus of arthritis treatment is to control pain, minimize joint damage, improve or maintain physical function and quality of life. In inflammatory types of arthritis, it is also important to control inflammation. According to the American College of Rheumatology, arthritis treatment can include medications, non-drug therapies such as physical therapy or patient education, and sometimes surgery. Managing your arthritis symptoms is very important as well. Learn what you can do to manage your arthritis. Top of page 2. What can I do to manage my arthritis? Properly managing your arthritis can help you decrease pain, improve function, stay productive, lower health care costs. Self-management is what you do day to day to manage your condition and stay healthy. Practice proven self-management strategies to reduce arthritis pain so you can pursue the activities that are important to you. Learn what you can do to manage your arthritis. Top of page 3. Can I exercise with arthritis? Arthritis-friendly physical activity is good for people with arthritis. Regular physical activity can help relieve arthritis pain and stiffness, give you more energy, lift your mood and make you feel more positive. Stay as active as your health allows, and change your activity level depending on your arthritis symptoms. Some physical activity is better than none. Learn about physical activity for people with arthritis and CDC recommended physical activity programs. Top of page 4. What should I do if I have pain when I exercise? It's normal to have some pain, stiffness, and swelling after starting a new physical activity program. It may take 6 to 8 weeks for your joints to get used to your new activity level, but sticking with your activity program will result in long-term pain relief. Here are some ways to manage your pain while your joints adjust to your new activity level. Tips for managing your pain during and after exercise. Until your pain improves, modify your physical activity program by exercising less frequently, days per week, for shorter periods of time, amount of time each session, or with less intensity. Try a different type of exercise to reduce pressure on your joints, for example, switch from walking to water aerobics. Do proper warm-up and cool down before and after exercise. Exercise at a comfortable pace. You should be able to carry on a conversation while exercising. Make sure you have good-fitting, comfortable shoes. See your doctor if you experience any of the following: pain that is sharp, stabbing, and constant. Pain that causes you to limp. Pain that lasts more than 2 hours after exercise or gets worse at night. Pain or swelling that does not get better with rest, medication, or hot or cold packs. Large increases in swelling or if your joints feel hot or red. Learn more about physical activity for people with arthritis. Top of page 5. Does being overweight affect arthritis? It is important for people with arthritis to maintain a healthy weight. For people who are overweight or obese, losing weight reduces pressure on joints, particularly weight-bearing joints like the hips and knees. In fact, losing as little as 10 to 12 pounds can reduce pain and improve function for people with arthritis. At any age, low-impact, arthritis-friendly physical activity and diet changes can help you lose weight. Learn about managing your weight at CDC's Healthy Weight website. Osteoarthritis, what is it? More people have this condition than any other form of arthritis. It's the wear and tear that happens when your joints are overused. It usually happens with age, but it can also come from joint injuries or obesity, which puts extra stress on your joints. Joints that bear weight, like your knees, hips, feet, and spine, are the most common places it affects. It often comes on gradually over months or years. It makes the affected joint hurt. But you don't feel sick or have the fatigue that comes with some other types of arthritis. What happens? You lose your body's shock absorber. Cartilage, the slippery material that covers the ends of bones, gradually breaks down. One example is what can happen to your knees when you're overweight. The extra pounds put more pressure on the cartilage as it gets squeezed between the bones. It gets damaged and wears away, so there isn't as much left to cushion the joint. The damaged cartilage makes movement painful. You may hear a grating sound when the roughened cartilage on the surface of the bones rubs together. You may get painful spurs or bumps on the end of the bones, especially on fingers and feet. The joint lining can get inflamed, but it's not common with osteoarthritis. Symptoms depend on which joint or joints are affected. You may have deep, aching pain, trouble dressing, combing your hair, gripping things, bending over, squatting, or climbing stairs, depending on which joints are involved. Morning stiffness that typically lasts less than 30 minutes. Pain when walking. Stiffness after resting. Your joint may be warm to the touch, swollen and harder to move, unable to move through a full range of motion. Learn ways you can help manage OA at home. Rheumatoid arthritis. What is it? RA is an autoimmune disease. That means the immune system attacks parts of the body, especially the joints. That leads to inflammation, which can cause severe joint damage if you don't treat it. About 1 out of every 5 people who have rheumatoid arthritis get lumps on their skin called rheumatoid nodules. These often form over joint areas that receive pressure, such as over knuckles, elbows, or heels. What happens? Doctors don't know exactly what causes RA. Some experts believe the immune system becomes confused after an infection with a bacteria or virus and starts to attack your joints. This battle can spread to other areas of the body. Scientists think 2 of the body's chemicals that are related to inflammation, tumor necrosis factor (TNF) and interleukin-1, trigger other parts of the immune system in rheumatoid arthritis. Medicines that block TNF, interleukin-1, and interleukin-6 can improve the symptoms and prevent joint damage. Symptoms can come on gradually or start suddenly. They're often more severe than with osteoarthritis. The most common include pain, stiffness, and swelling in your hands, wrists, elbows, shoulders, knees, ankles, feet, jaw, and neck. Rheumatoid arthritis usually affects multiple joints. More than one swollen joint. Usually, it's small joints in your wrists, hands, or feet. A symmetrical pattern. When the knuckles on your left hand are inflamed, the knuckles on your right hand probably will be as well. After some time, you may notice more of your joints feel warm or become painful or swollen. Morning stiffness then can last for hours or even most of the day. You may also feel fatigued and notice that your appetite is down and you've lost weight. Find out about lab and blood tests for RA. Continue reading below. Psoriatic arthritis. What is it? People with this condition have inflammation of the skin, psoriasis, and joints, arthritis. Psoriasis causes patchy, raised, red and white areas of inflamed skin with scales. It usually affects the tips of the elbows and knees, the scalp, the navel, and skin around the genital areas or anus. Only about 10% to 30% of people with psoriasis will also get psoriatic arthritis. What happens? This type of arthritis usually starts between ages 30 and 50, but it can start as early as childhood. It's equally common among men and women. The skin disease, psoriasis, usually shows up first. Symptoms: psoriatic arthritis can swell the fingers and toes. People who have it often have fingernails that are pitted or discolored, too. In some people, only one joint or a few joints are affected. For example, you could have it in only one knee. Sometimes, it affects the spine or just the fingers and toes. Learn how doctors diagnose psoriatic arthritis. Gout. What is it? A buildup of uric acid crystals in a joint. Most of the time, it's your big toe or another part of your foot. What happens? Often you wake up with a sudden, sharp pain in your big toe after a night of drinking. But drugs, stress, or another illness can also trigger a gout attack. The attack will last between 3 and 10 days, even if you don't treat it. It may be months or years before you have another one, but over time, attacks will grow more frequent. And they may last longer, too. If gout goes untreated too long, it can affect your joints and kidneys. Gout results from one of 3 things. Your body is making more uric acid. Your kidneys can't process the uric acid your body makes. You're eating too many foods that raise uric acid levels. Symptoms: they almost always come on quickly. You'll notice intense joint pain. It'll probably be in your big toe, but it could also be in your ankles, knees, elbows, wrists, or fingers. Discomfort: even after the sharp pain goes away, your joint will still hurt. Inflammation and redness: the joint will be red, swollen, and tender. Hard to move: your joint will be stiff. Get information on how you can prevent gout. Lupus, what is it? Lupus, also called SLE or systemic lupus erythematosus, is an autoimmune disease. It can affect your joints and many organs in your body. What happens? Doctors don't know exactly what causes lupus, but something makes your immune system go awry. Instead of attacking viruses and other invaders, it starts to cause inflammation and pain throughout your body, from your joints, to your organs, to your brain. Women of childbearing age are more likely to get lupus than men. It affects African American women more often than white women. It usually appears between ages 15 and 44. Symptoms: painful, swollen joints, fatigue, headache, swelling in the feet, legs, hands, or around the eyes, rashes, including a butterfly rash across the cheeks, mouth, sores, sun sensitivity, hair loss, blue or white fingers or toes when exposed to cold, Raynaud's phenomenon, blood disorders, like anemia and low levels of white blood cells or platelets, chest pain from inflammation of the lining of the heart or lungs.